If you are one of the millions of Americans who get health insurance from your job, it is time to check your mailbox. This morning's Money Watch looks at this year's open enrollment period. It is when you choose your benefits for next year, and there is always a lot to think about. So we've got CBS News business analyst Jill Schlesinger here with the information you need to make the right choices. Good morning.
Good morning.
All right, so what should people consider when they're determining the best insurance plan, and does it make sense after you've already done it last year to look again and do it something different?
Absolutely. I know our first inclination, check the box, just do what I did last year. But these plans change from year to year. It may be that you got a new doctor or your doctor is no longer in your network. A drug that has been prescribed and covered, that may have fallen in or out of your particular plan. You've got to look at all of the plans available. Make sure this is where you can actually make a difference. Remember, we're talking about premium increases of 6 or 7%. It's about twice the rate of inflation. Spending some time with these forms, which are so boring, I know your eyes are glazing over.
No, but it's important.
It can save you a lot of money next
So
year.
let's talk about these high deductible insurance plans that a lot of companies are offering, which have these lower annual premiums. So how do they work, and how should people use them?
Okay, they're really interesting. It used to be that people would say, oh, if I'm young and healthy, this is great. Lower premiums, I have a higher deductible. But more and more employees and more companies are offering these because they're paired with something called a health savings account. Now, these are triple tax advantage, meaning the money that goes into that health savings account, there's no tax on it. The money that is in that health savings account, no tax. When you take it out to pay for any health expenses, either soon or decades in the future, no tax due. So it allows you to save money on a tax-efficient basis, and that'll pay for those premiums or any other costs down the line. It's not locked into your current plan. You can take it with you.
Yeah, I love those. All right, let's talk about open enrollment for Medicare. If you are age 65, what do you need to know about your health care?
It is a dizzying process, and I want to be clear that if you are doing this, try to grab somebody who's in your life who's really going to help you out. Same process for someone who is 65 or older. Are my drugs still covered? Are my doctors still covered? By the way, there are big insurance companies that pull out of Medicare wholesale, so you've got to go through this process. I will pay some special attention to the prescription drug plan Part D, because people who spend time looking at these drug plans are able to save about 5% in the subsequent year. Again, huge dollars on the line, Vlad.
Wow, always great information, Jill. As always, thank you, my friend. Appreciate it.